Hello guys, welcome to our channel. Today we are going to discuss about the microbiology part 2. In this part 2 I am going to discuss about the mycology, virology and the parasitology. We are going to wrap up the microbiology. So those who are new to this channel, please do subscribe and share with your friends. And now we are going to discuss about the one of the most important topics, mycology. And in the mycology, first you have to understand which are the forms are like yeast, like budding yeast, or the pseudo hyphae and the proper hyphae formation. Okay, under the microscope you are going to see these kind of the pictures. Let's see the examples. The yeast forms, most commonly they are the cryptococcus neoformans, yeast like fungi, those are the candida albicans. Mold forms, which are the multicellular hyphae, aspergillus, mucormycosis, and the dimorphic fungi, means it is going to be the yeast in some tissues and mold in the form of the environment of 25 degrees Celsius. What are the examples? Histoplasma, blastomyces, coccidioides, spirothrix, and the parococcidiosis. Next, dimorphic fungi. Dimorphic fungi, just now we discussed. So they are going to show the two different forms. One are going to be the mold, other one is going to be the yeast, right? Next, another thing that you have to remember is the some of the fungus they are going to specifically for the geographically. For example, histoplasma. This is for the Ohio, blastomyces for the Central Asia, and sporothrix for the worldwide most commonly gardener's disease, coccidiosis Southwest USA. Okay, these are the some of the very peculiar history that the examiner is going to ask you. Next, paracoccidio is in the Latin America. Next, pityriasis versicolor, the most common is the globosa, and this fungus is going to cause these kind of hypomagnetic and the hypermagnetic macules with the fine scaling, most common most commonly in the upper trunk. The pathogenesis is they produce the azelaic acid, so melanocyte suppression will be seen. That's why pigmentary changes are seen. On the KOH mode, you are going to see this meatball spaghetti appearances. Okay, spaghetti meatball appearances that you are going to see. Under the wood lamp, you are going to see the yellowish green color fluorescence. Next, coming to the dermatophytes, the trichophyton, it is going to be seen in the skin, hair, and nails also. Microsporum only seen in the two, skin and hair, whereas the epidermophyton seen in the skin and the nails. Next, types of the Taenia. For example, Taenia capitis, most commonly the favus is by the Sconlani, carry on by the Mento gryphyta. So capitis means the scalp, barbae is the beard, faciae is the non-bearded face, corporis is the trunk or the body, and the curis is the groin region, pedis foot, manum is the palms, unguium is the nails, and imbricate is the trunk and the limbs, incognita any site, those who are using the steroids, Gladitorum is on the face, arms, especially in the wrestlers, and the favosa is on the scalp. Okay. Next, we have to know about their shape. Okay. This is also commonly asked. So, trichophyton will be seen in the pencil-shaped, microsporum in the spindle shape, and epidermophyton in the club shape. Okay. These are the shapes also asked in the examination. Next, eumycetoma, commonly caused by the Madurella mycetomatous fungus infection and also associated with the actinomyces. Chronic localized subcutaneous fungal infection which is going to show the draining of the sinuses with the granules that you are going to see from this lesion. How you are going to see? Same. These granules has to be microscopy and culture where you are going to see whether it is a fungal or any other. So what is the treatment? Itraconazole and the surgical debridement should be done. Chronoblastomycosis, you are going to see this kind of the pigmented demeticious fungi that is going to see the copper penny bodies on the microscope and cauliflower lesions on the patient's legs. What are the species? Phonecia pedrosae or the Cladophiliophora caroni. These are the kind of species that is associated with the chromoblastomycosis. And next, they are medullary bodies, sclerotic bodies or the copper penny bodies. Again, the drug is the common itraconazole. Next is sporotrichosis, which is going to caused by the Sporothrix kizinski, and this is going to follow the lymphatic pattern. Okay, this is going to follow the lymphatic pattern where the lesion also turns out to be like that only. And next, these patients is usually have the history of the gardeners. Okay, so gardener, those who are having the thrown injury that you are going to see. and this floret appearances that you are going to see, and cigar shaped yeast cells also seen on the microscopy. Same, the drug of the choice is the itraconazole. Next, histoplasmosis. Histoplasmosis, it is due to histoplasma capsulatum dimorphic fungi, inhalation of the bird and the bat droppings due to acute pulmonary, chronic pulmonary, and the complete systemic disease also seen in this patient, where you are going to see the dimorphic fungi with the budding yeast that you are going to see, like wheel like appearances that you are going to see under the microscope, and the drug of the choice is the itraconazole. Next, candida. Candida is the common organism that is going to be caused is the candida albicans, okay, commonly. Next, this is the oval budding yeast cells with the pseudo hyphae, and the true hyphae is seen in the germ tube positivity. Most commonly, this is going to cause the oral thrush, vaginal candidiasis, diaper rash in the children, and areas it is going to has, and also invasive those who are in the immunocompromised, candidiasis in the blood infection, endocarditis, disseminated systemic infections also seen. How you are going to diagnose? Most commonly KOH for all the fungi, where you are going to see this budding yeast and the pseudohyphae, germ tube test, and also separate agar, chrome agar that you are going to see. One of the examples, this is the KOH mode, this is the germ tube, where is the mother cells and the other cells that you are going to see. Next, Cryptococcus. Cryptococcus neoformis, this is most commonly due to soil or the inhalation of the bird droppings that you are going to see. And in the immunocompromised, meningitis, pneumonia is a common. And India ink stain, which will show the capsule fungi as the CSF or the serum, you are going to see the positive of the cryptococcal antigen. What is the treatment? Amphotericin B with the flucytosine, which will be given. This question is also asked in the examination previously. Next, rhizopus, mycor. These are going to cause the mucormycosis, and they are the very danger infection. Okay, because those who are having the immunocompromisation like the diabetes mellitus, immunosuppression, neutropenia, they are very prone to have, and they can easily cause the angioinvasion. What is meant by the angioinvasion? It is the blood, whichever the blood places also it is going to be inhabitant, and they are going to cause the infection there and cause the necrosis, like rhinocerebral, which is most commonly CNS infection if it is caused, especially post COVID we have seen. And broad non-septic fungi, here you can see this is how the septa will be seen, right angle branching, and surgical debridement, and the amphotericin B is the drug of the choice. Next, aspergillosis, same like the mucormycosis does look, but it is having the very narrow acute angle. Okay, it is going to have the very narrow 45 degrees. Okay, 45 degrees that you are going to see the branching. Aspergillus fumigatus is the most common, and this is associated with the allergic bronchopulmonary aspergillosis, aspergilloma in the fungus ball in the lung cavity, and the invasive condition. Here the drug of the choice is a oriconazole, right? Next, pneumocystis. This is not a direct fungus, a typical fungus. This is especially immunocompromised patients you are going to see, and on the appearances you are going to see the pink ball appearances. This is known as a pink ball appearances on the gory methionine silver stain that you are going to see. Next, coming to the parasitology, first protozoans such as entamoeba histolytica. This is going to cause the diarrhea. Most commonly you all know. What is the infective form? This is the quadrinucleate. Okay, 4 nucleate that you are going to see. This is the tropozoite that is going to cause the fecal-oral route. So same, the fecal-oral route which is going to cause the infection. You don't have to learn the every cycle, at least know the important points. Next, pathogenesis. This is going to cause the liver abscesses. When you going to aspirate this liver abscesses, you are going to see the anchovy kind of pus that you are going to see. What is the most common? The lobe that is involved, right inferior lobe, and also cause the flask shaped ulcers in the colon region. And this is going to be positive for the serology, and on the culture medias, Balmuth media and the Philips media. The drug of the choice is the metronidazole. Carriers can give the paramomycin. Next, acanthamoeba species. This is going to cause the keratitis with the contact lens in the dirty water. or the amoebic encephalitis. And portal of the entry is through the skin and the respiratory tract or the eyes. This is how the patient is going to lose the corneal infection, vision loss also. Culture or the biopsy you can get from the brain or the CSF biopsy, where you are going to see the cyst and the trophocytes. On the corneal you are going to see the cyst. Treatment is very difficult, so that the prevention is very better. So that's why the most common drug is the PHMB, but the PHMB is not available in the India. So we are going to use the chlorhexidine combination. Giardia lamblia, which you are going to see the twitching leaf appearances, right? The leaf-like motility you are going to see, and this is going to cause the giardiasis, very most dysentery kind of. The shape is the pear-shaped bilaterally symmetrical, and the infective form again quadrinucleate form, and this is going to cause the steatorrhea, flatulence, greasy, foul-smelling diarrhea you are going to see. Drug of the choice is the metronidazole. Trichomonas Trichomonas is going to be the only trophozoite form. T for T, T for trophozoite. Okay, no cyst that you are going to see. So the four anterior flagella that you are going to commonly identification for this one. And in the females, it is going to cause the vaginitis, strawberry cervix. You are going to see here. This is the strawberry kind of cervix, and here the discharge. And what you have to do, metronidazole, and also treat the partner, because this is the only protozoal infection known as the STD. Okay, next trypanosoma. So the important points of the trypanosoma is the trypanosoma brucei. It is going to cause the West American sleeping sickness, and the trypanosoma brucei rhodiense. It is going to cause the East African sleeping sickness. The most important is the trypanosoma brucei gambiense, which will cause the West American sleeping sickness. All right. What is the vector? The vector is the Glossina or the Tessi fly. This is the Tessi fly. Okay. Next, pathogenesis, fever, lymphadenopathy, winter bottom sign. This is known as a winter bottom sign. Nothing but the cervical lymphadenopathy, and it can cause the sleep disturbances. That's why the disease is known as the Western African sleeping sickness. Cruzi. Next, trypanosoma cruzi. C for cruzi, C for Chagas disease. Okay. The causative agent is this one, the redwood bug, or also known as a kissing bug. And this one is going to cause a Romana sign. Romana sign means the eyelid swelling that you are going to see. Myocarditis, cardiomyopathy, megacolon, megaesophagus, one of the most common are deterrent complications of this condition. Treatment is the benzinidazole. Okay, that is the one which we are going to give. Leishmania species. Leishmania common agent is the sandfly. Phlebotomus is the scientific name. It is going to cause the Kala Azar, black fever, visceral leishmania. The species is the Leishmania dono 1, and they are going to cause the oriental sore, Delhi boil, Baghdad boil. All these are the common names. And fever, hepatosplenomegaly. And after that, you are going to have the post Kala Azar dermal leishmaniasis. After the 2 years of the treatment, for these patients, we are going to give the sodium stibogluconate. And under the diagnosis of the bone marrow aspiration, these kind of the bodies that you are going to see, which is known as a LD bodies, or the kinetoplast that you are going to see. And the RK39 antigen test is also asked in the examination. We are going to use for the leishmania. Leishmania tropica is going to cause the cutaneous leishmanias, and Braziliensis mucocutaneous leishmaniasis. Next, coming to the Plasmodium, malaria parasite. You all know the most common agent is the Anopheles mosquito, and there are the different species. The Vivax, falciparum, malariae, ovale, novansky. Falciparum is the most common worldwide, and the Vivax and the ovale is going to cause the most commonly they are going to cause the hypnozoites. That means the relapse is going to be seen. Falciparum can cause the cerebral malaria because all stages of the RBC is involved. So cerebral malaria going to show the Durex granuloma, right? These all are the important points only. Next, asexual phase in the humans and the sexual phase in the mosquitoes. Asexual phase is first the sporocyte, that is the one which will be getting from the mosquito. Then it will enter into the pre-erythrocytic phase, and from there it is going to form the merocytes. Once these merocytes are infect the other RBCs, that means it is a erythrocytic schizoid. and again they transform into the gametophytes. Again mosquito takes, they develop, and they again give back to us. This is the how the formation is seen. Next is some of the important features that you have to know. This is a male gametocyte. This is how it is look. Female gametocyte, you are going to see in between the nuclei is seen. The cytoid which will be filled with the multiple merozoites. Okay, so these are the single ring and double ring that you are going to see in the RBCs. All right, next important points that you have to know. This is the gametocyte, falciparum, malariae, ovale, and the vivax. So Vivax is going to show the skimmer joint, Skiffner dots. Okay, Skiffner dots. Here you can see this is the Skiffner dots. Ovale going to show the James dots, and Malariae is going to show the Siemens dots. Falciparum is going to show the Moriar's clefts. All right. Next, cestodes coming to the tapeworms. Diphyllobothrium latum, which is caused by the fish tapeworms. Most commonly, this is due to the larva of the undercooked fish, where you are going to get a longest tapeworm of the humans. And disease is mostly gastrointestinal only, small intestine. It can cause a vitamin B12 deficiency. And here you can see this is how the egg appearances that you are going to see. Operculated eggs that you are going to see. The drug of the choice is the praziquantel. Hemolepsis nana. This is the dwarf tapeworm, smallest tapeworm, and there is no intermediate host is needed for the nana. Again, you are going to see the auto-infection, especially those who are suffering from the immunocompromisation also. And here you can see these are the polar filaments. On the egg, you are going to see the polar filaments and these kind of hooks that you are going to see. Next, Echinococcus granulosus, commonly associated with the sheep and the dog. Dog is the definitive, D for the D for the dog. Infective form is the also dog feces. Sorry guys. And the disease is the hydatid cyst formation. Here you can see this is the cyst formation. Lungs is also involved. If they rupture, it can cause the anaphylaxis. And next, Cassoni test is positive, which is seen in the type 1 hypersensitivity reaction. What is the treatment? Surgery we are going to see. Percutaneous aspiration, and also you are going to remove that from the immediately from the liver. The drug of the choice is the albendazole plus the praziquantel. Next is Taenia solium versus the Taenia saginata. Solium is due to pig, pork. Saginata is due to the beef commonly. And solium is going to cause it is going to cause the auto infection, as well as it is going to cause the CNS infection also. Whereas saginata is does not going to cause the no CNS is seen. Okay, first thing that you have to remember. Next is solium. If you observe, the solium also have the hooks, right? The saginata does not have the hooks, right? They don't have the any hooks, and like this you are going to identify the saginata, and hooks is present, then it is a solium. Neurocysticercosis, just I was telling, that is associated with the Taenia solium. Drug of the choice for them is the albendazole that you have to give, plus the steroids and also anti-epileptics, right? Anti-epileptics that we are going to give for this patient. Cystosoma species. This is the hematobium, okay, and where you are going to see in the hematobium the lateral spine, okay, like this, the spine will be seen, and this is the monsoni lateral spine. This is the monsoni, and here japonicum. Japonicum is in the round form that you are going to see. Hematobium is going to cause the urinary symptoms, okay, bladder cancer associated. Monsoni, it is going to cause the intestinal cystosomiosis and the hepatic fibrosis. Japonicum is going to cause the hepatosplenic disease, and Japonicum can also cause the seizures. Okay, Japonicum can also cause the seizures. This is the Ascaris lumbricoides, nematodes, roundworm, most commonly due to the infection due to the embryonic egg and the ingestion of the fecal oral route. If it is enter the lungs, it can cause the Loeffler syndrome. The diagnosis will be most commonly by stool culture, bile, stained, mammalated eggs in the stool. And albendazole is the treatment of the choice. Tricure is trichuria, where you are going to see the barrel-shaped egg, the polar plugs, and rectal prolapse is a common complication associated with this one. Enterobius vermicularis, D-shaped eggs, okay, D-shaped eggs that you are going to see, commonly seen with the children, and auto-infection is seen, and perianal itching, and also especially night auto-infection, and in the family members also you are going to see. Cellophane tape test is commonly done for this patient. Again, albendazole is the common drug of the choice. Ankylostoma and Necator americanus hookworms, they are going to cause the iron deficiency anemia. They are going to get the transmitted from the skin penetration. Okay, filariform larva. Strongyloides, again this is also via skin only, where you are going to get infection from the skin, auto infection in the immunocompromised patients, and commonly they are going to cause the diarrhea, pneumonia, and the sepsis. Again, this is also going to associate with the Loeffler's syndrome. Drug of the choice is the ivermectin. Next, filaria. Coming to the Wuchereria bancrofti, Culex mosquito is a common form of the organism that can cause. What happened? The patients will be having the lymphatics, which will be more filled with the lymphadenoma, which is also known as a elephantiasis. Right. Next, the microfilaria. You have to see no nuclei in the tail tip. Okay. This is the tail tip where you are not going to see the specific nail nuclei, and this is the sheath. Here you can see. This is the sheath that is going to be covered. Next, the drug of the choice is the diethylcarbamazine, and the albendazole is given for this patient. Next, virology. Virology, the two things that you have to remember. The most commonly, the DNA viruses are happy. What is the happy? Herpes, hepatena, adeno, parvo, pox, papavo, and polyoma and the papilloma. These all are going to be the DNA viruses. Remaining all you can remember, if it is not in this, obviously they are the RNA viruses. And inclusion bodies, what are the commonly seen? Rabies is going to show the Negri bodies. Variola is going to show the Passion bodies. Herpes is going to show the Quadri type A. Molluscum Henderson-Peterson bodies, like this Henderson-Peterson bodies. Cytomegalovirus, owl's eye appearances. Adenovirus shows the Cowdery type B. Pox virus, Guarneri bodies. Measles virus, Werthin-Finkel-J bodies that you are going to see. Parvovirus B19, intranuclear inclusions. Next, coming to the herpes, type 1, type 2. Type 1, commonly children, oral herpes. Type 2, genital herpes, STD. Right? And next, herpes type 1, you are going to see this cold sore. Okay, cold sore is commonly associated. Whereas on the genital, vulva, penis, you are going to see the herpes simplex type 2. And next, herpes type 1, it is going to cause the temporal lobe meningitis or the encephalitis. Type 2, it is going to cause the moderate meningitis, means adult onset viral infection. Next, the latency phase, trigeminal ganglia type 1, sacral ganglia type 2. Okay, next, varicella zoster. It is going to cause the chicken pox in the children, and you are going to see the multiple at a time polymorphic rash you are going to see, and dew drop appearances like a rose petal that is seen. Right? After the initial infection, the virus becomes the latent and that is present in the dorsal root ganglia. And reactivation can lead to the shingles or the herpes zoster virus that is here. This is the herpes zoster. Dermatome is involved. Very painful condition that the patient is going to present. Next, Ramsay Hunt syndrome. Herpes zoster oticus. Oticus means ear plus facial palsy plus the herpes infection that is seen in this patient, Ramsay Hunt syndrome. Justin Bieber is also got this condition. Respiratory route is a commonly the route of spread and prevented by the live vaccine. Oka is the common strain that we are going to use. Epstein-Barr virus. It is going to cause the infectious mononucleosis or the kissing disease, commonly known, and it can infect the B cells and establishes the latency period. Associated with the multiple malignancies like Burkitt lymphoma, oral hairy leukemia, and non-Hodgkin lymphoma, nasopharyngeal carcinoma. Cytomegalovirus is going to cause the owl-side nuclear inclusions. Commonly, they are going to infect the patients, those who are suffering from the low, very much low type of the CD cells, like CMV retinitis in the HIV patients. And what is the best thing that can be done for this patient? Urine. Okay, urine is the best diagnostic test for this patient. The drug of the choice is the ganciclovir. Next, HHV6. This is going to cause the Rochella infantum, exanthum subitum. That means complete the rash on the body that you are going to see. High fever lasting 3 to 5 days and followed by the diffuse rash. HHV8, it is going to cause a Kaposi sarcoma, a vascular tumor commonly seen with the AIDS patient. And transmission is via the patients with a sexual contact, possibly the saliva infection that is going to be seen. Adenovirus, that is going to cause the erythema infectiosum, fifth disease, and common organism is the parvovirus B90. And next, it is going to show the common feature, the slapped cheek appearances in the children. And if it is triggered the erythroblast cells, it can cause the aplastic anemia in the pregnancy patients. Molluscum contagiosum. This is also a pox virus, very large among all the viruses, double-stranded DNA virus, and it can cause the pearly. Here you can see this is a pearly umbilicated papules on the skin, which is commonly seen, and it can be the direct contact and also can be the STD in the adults. And we already discussed the biopsy can show the Henderson-Peterson bodies. HPV types. Common wards are associated with the 1, 2, 3, 4 and 6 and 11, which will be associated with the condyloma acuminata genital wards. 16 and 18 associated with the cervical cancer and the anogenital cancers. Next, poliovirus is going to cause the most commonly, it is going to cause the muscle paralysis. Okay, muscle paralysis, which will be seen in India right now. It is not present, and vaccines that we are going to use the K for K and K for killed. This is the Salk vaccine. Live is the Sabin vaccine. And most commonly type 1, type 2, type 3. Type 3 is only associated, that is vaccine associated. Okay, vaccine associated is the type 3. Some of the incidents that has been showing, but most of them are already eradicated. These are the important Coxsackie points and the diseases it is that going to cause the hand, foot, mouth disease, those who are new to this channel, please do subscribe. And acute hemorrhagic conjunctivitis. The species are the Coxsackie virus 24 and the enterovirus 70 plus. Coxsackie B, myocarditis and the pericarditis, and pleurodynia bourbon disease. Enterovirus 70, acute hemorrhagic conjunctivitis, 71, neurologic disease, 72, hepatitis. Influenza virus, they are going to have some different types. Most commonly, they contain the important points hema-agglutinin and the neuroaminidase. These are the two enzymes that will trigger the infection into our bodies. And Orthomyxoviridae is the common family that is associated. What is the antigenic drift, antigenic shift? Antigenic drift is the point mutations and antigenic shift is the resortment of the pandemics. Investigation of the choice is the PCR, drug of the choice is the oseltamivir. Mumps virus, Paramyxoviridae family, and infectivity period is the 1 week before and after the symptoms. Common symptoms, parotitis, parotid gland swelling, orchitis, it can cause the infertility, post-puberty patients. Overall, the most common complication will be aseptic meningitis from the mumps virus. MMR vaccine, the strain that we are going to use is Geraldine strain. Measles virus, also known as the rubeola, and they are going to cause the common C's, cough, coryza, conjunctivitis, right? Maculopapular rash and the Koplik spots. What are the Koplik spots? Here you are going to see. These are the Koplik spot, fine rice granule kind of, where you are going to see in the buccal mucosa. The most common overall complication is the otitis media. Most common cause of death is the pneumonia. Late and deadly will be the SSP. This question is also asked. Subacute sclerosing panencephalitis will be seen in this patient. What is the treatment? Vitamin A with a supportive treatment. MMR strain again, Edmonster Jacob is a common strain that we are going to use for this infection. Rabies, Rhabdoviridae, bullet shaped classic image that you are going to see. Animal bites such as dogs and bats, and the important points are that it is going to cause the hydrophobia and 100% mortal. Okay, this is the 100% secondary attack rate and mortality. One point that you have to remember. And on the inclusion bodies, negri bodies that you are going to see. How you are going to prevent post exposure or the pre exposure. Okay, next, chikungunya virus. This is going to cause the high fever and severe joint pains. That is the common symptoms. Vector will be the Aedes mosquito. This is known as a chick sign. Okay, chick sign is seen due to melanin deposition. Rubella virus, German measles. Togaviridae is the family, and these patients will be having this one. This is known as a Forshemer spots. Forshemer spots, mild fever, maculopapular rash, post-auricular lymphadenopathy. Lymphadenopathy we not see in the measles, but we are seeing in the this one. That is the difference. Congenital rubella syndrome, cataracts, patent ductus arteriosus, and the deafness that you are going to see. Congenital glaucoma is also associated. Dengue virus flaviviridae is Aedes aegypti is the vector that is associated, and dengue virus they are the more four types in the lifetime. Every person can get the four times of the dengue virus. Then two is considered to be the most severe, and it can cause the fever, hemorrhagic fever, and if it is progressed, it can cause the shock also. Dengue hemorrhagic shock syndrome also see. Why dengue virus is having this kind of infection? Because it has a special mechanism, antibody dependent enhancement. So antibody dependent enhancement which will increase and trigger the more infection in the body. Next, tourniquet test. This is known as a tourniquet where you are going to tie the tourniquet. After tourniquet, you are going to see this kind of the eruption of the rash on the cubital fossa. Japanese encephalitis virus. This is the most common cause of the encephalitis in the India. And what are the vector? Culex mosquito. And what are the reservoirs? These are the birds, arbid birds, and high mortality and the neurological sequelae which will be seen in this patient. So these are the important topics and important points only. I am not telling the overall review, but these are the important points and the commonly asked points in the examination. So those who are new to this channel, please do subscribe and share with your friends. Soon we are going to launch the RRR 2.5 and along with that image based book, okay, and also 100 one-liners book, and we are going to give the drug of the choice, formulas, and short series books, and all this will be included in the program. Along with that, there will be rapid revision, video lectures, and also MCQ practice. Okay, stay tuned. We are going to update the details about the next batch for the upcoming June 2022. So those who are new to this channel, again, please do subscribe and share with your friends, and also join the Telegram group in the link given in the below. So until then, see you guys. Happy preparation. All the best.